Hello, my name is Nguyen Lee. I'm doing Ignite Talk for LTEC 2010. The topic of this Ignite Talks is about communication skills for pharmacy technicians in the workplace. All of these skills I learned from my own experiments in reverse jobs. What a communication skill for pharmacy technician should be empathic and compassionate listener. Communication skills are really important because they must handle a lot of information with precision and accuracy. Should be friendly and interactive with patients and other members of the team. Avoid interruption. Listening skill does not mean waiting for your turn to talk. You cannot focus on what somebody say if you're going to say you are forming what you're going to say next. Speaker can read your facial expressions and know that your mind is aware but not in the conversation. Focus fully on the speaker. You can listen in engaged ways if you're constantly checking your phone. Stay focused on the important nonverbal clues. Try repeating their word over your head. It will reinforce their message and help you stay focused. Communication with concern. Maintain a friendly attitude, providing all patients with the advice necessary to fully assist them. Express medical terms in a way that the patient can understand. Nonverbal. Rolling your eyes or saying cloudly show impatience and disrespect to customer. Facial expressions is friendly. The patient will be most likely to respond in positive manner. Demonstrate positive body language to make your communicate with the patient more effectively. Establish a sense of trust, asking them how they are doing upon each visit, learning return patient name, develop trust. You need to focus on maintaining a sense of honesty and combination with professionalism at all times. Keep communication simple, short. Being specific when providing messages for or advice to patients will help them remember what they are told. Use short words. Patients will be recall more of what being said. Must identify the most important message to deliver to the patient. Effective of questions. If the text moves through the questions or instructions too fast, the patient may become confused, misunderstand what it asks. Never asking more than one question at a time. Competence questions ensure the text obtain necessary information to identify the patient needs and treat-related problems. Telephones. Always specify your business location, your names and your title when you answer the phone. Determine whether the task is within your scopes or forward to a pharmacist. Online communication. You will need to contact with the doctor about prescriptions and may need to contact with physician to authorize refills. Working in community pharmacists will also need to communicate with a pharmacist if they have a question about particular patients or prescription. Always keep your feelings in check as you communicate with your patients. If you feel frustrations, pause for a moment and take a deep breath. Ask for reschedule the discussion for later in time if needed. Why team satisfaction is important. Communication between members of the healthcare teams affect the quality of work relationships and profound impact on patient safety. When communicate about the tasks and responsibilities are done well, it can improve the job satisfaction. With hearing impaired patients. Ask how they refer to communicate and note in the computer. Always look at the patient when speaking. Never yell, instead using moderately voice. Prevent environment barrier. Environment barrier include lack of quiet privately to talk, reduce item on the counter to reduce the distractions. A pharmacy technician try to take a few times to speak privately with patient. Communicate by email. Pharmacy technicians are likely to ask about administrations of particular medications. Avoid sending an email when you are feeling any kind of negative emotion. Patient satisfaction. Patient satisfaction increases when members of the healthcare team take the problem seriously, try to understand the patient's experiments, and provide viable options. Empathy. Putting yourself in patient situations. Demonstrate understanding of the patient feeling to create a trusting relationship. Show empathy nonverbal by reflecting the patient's facial expression. Mistake during pharmacy technicians should avoid. Keep turning around when your client is trying to talk. Not allowing time for questions. Asking only closed questions, meaning the questions only can answer yes or no. Patient barrier may include feeling uncomfortable to ask questions about the medications. Maintain eye contact with the patient when you are speaking and encourage patients to ask questions and take time to respond for questions in a thoughtful way. Communication benefit the workplace, increase satisfaction between patients' relationship and pharmacy technician, improve patient trust in pharmacist counseling, and effective exchange of information is needed for pharmacy technician to appreciate patient needs and for the patient to understand and accept your recommendations. Thank you for your time and hope this Ignite Talk helpful to have an effective communication skill for pharmacy technician.